Can you avoid pain from contrast dye in lung cancer court? Can you avoid pain from contrast dye in lung cancer court scans? This is a common concern for many patients. When undergoing a computed tomography scan for lung cancer, contrast dye is often injected into a vein to enhance the images. While the procedure is generally non-invasive and not painful, some patients may feel mild discomfort during the injection. This can include a brief burning or warm sensation as the dye enters the vein. However, this discomfort is usually temporary and mild. To help minimize or avoid any pain from the contrast dye, there are several strategies you can consider. First, it is essential to communicate openly with your healthcare team. Let them know if you have experienced discomfort during previous injections or if you have any allergies or anxiety. This information can help the radiology staff prepare and manage your experience more effectively. Another important factor is the technique used for the intravenous catheter placement. A skilled healthcare professional can ensure that the Roman 4 is placed correctly and in a suitable vein, which can reduce any pain associated with the injection. Additionally, the rate at which the contrast dye is injected can also make a difference. Slowing down the injection can help lessen the burning sensation that some patients experience. For individuals with a history of allergies or sensitivity to contrast dye, premedication with antihistamines or steroids may be recommended. This approach is primarily aimed at preventing allergic reactions rather than alleviating injection pain. Staying well hydrated before the scan is also beneficial. Hydration can help reduce the risk of kidney-related side effects and may improve overall comfort during the procedure. It is worth noting that not all court scans for lung cancer requiring the use of contrast dye. In many cases, a non-contrast court scan is sufficient for diagnosis, screening, or follow-up. This means that you may be able to avoid any potential discomfort from contrast agents altogether. Severe allergic reactions or kidney issues related to contrast dye are rare, especially when proper screening and precautions are in place. If you have impaired kidney function or a history of reactions to contrast dye, your healthcare provider will carefully evaluate the risks and benefits before proceeding with the scan. In summary, while some mild discomfort from contrast dye injection may occur, there are ways to minimize or avoid pain. Effective communication, skilled Roman 4 placement, and proper injection techniques can all contribute to a more comfortable experience. Additionally, remember that in many cases, contrast dye may not be necessary for your lung cancer court scan. Always discuss any concerns with your healthcare provider or radiologist to ensure the safest and most comfortable imaging experience.